Question 1. In light of recent developments in radiation safety, Mr. Thomas, a radiation safety officer, is responsible for overseeing the handling and disposal of radioactive materials at his facility. One of the workers accidentally spills a small amount of iodine-131-131, a radioactive material used in therapy. Mr. Thomas needs to address the situation immediately. What should he do first? A. Secure the area and immediately begin decontamination procedures. B. Report the incident to the Nuclear Regulatory Commission (NRC) before taking any further action. C. Evacuate the building and ensure no one enters the area. D. Inform the patient about the spill and wait for further instructions. Answer. Correct answer A. Secure the area and immediately begin decontamination procedures. Explanation. In any radioactive material spill, the first step is to secure the area and prevent further contamination. The ALARA, as low as reasonably achievable, principle is fundamental in radiation safety, and minimizing exposure to staff and patients is key. Once the area is secured, appropriate decontamination procedures should be implemented accordingly. Established protocols reporting to the NRC comes later, but immediate containment and decontamination are the highest priorities. Evacuation may be necessary if radiation levels are deemed unsafe, but securing the area is the initial step in response. NRC reporting is a secondary action. Question 2. When evaluating radiation safety for PET scans, Dr. Hamilton notices an increase in background radiation levels near the PET scanner. Which of the following is the most likely cause of this elevated radiation? A. Improper shielding of the scanner. B. Increased use of the scanner leading to higher patient doses. C. Degradation of the PET detector components. D. A malfunction in the dose calibrator used for the radiopharmaceutical. Answer. Correct answer A. Improper shielding of the scanner. Explanation. Proper shielding is essential in PET environments to prevent unnecessary radiation exposure to staff and patients. If background radiation levels are higher than expected, this suggests a problem with the shielding, such as inadequate materials or improper installation. Increased patient doses would not directly cause elevated background radiation unless there is a significant malfunction. Degradation of PET detectors typically affects imaging quality, not radiation leakage. A malfunctioning dose calibrator affects the administered dose, not the environmental radiation. Question 3. During a routine radiation safety audit, the team identifies several issues with the handling of radioactive waste at a medical facility. What should the safety officer do first to ensure regulatory compliance? A. Immediately suspend all radioactive waste handling operations. B. Report the issues to the appropriate state radiation control agency. C. Implement corrective actions based on internal findings. D. Hold a training session for all personnel involved in waste management. Answer. Correct answer C. Implement corrective actions based on internal findings. Explanation. The first step in addressing issues identified during a safety audit is to implement corrective actions based on internal findings. This may involve improving procedures, providing additional training, or upgrading equipment to address deficiencies. Immediate suspension of operations may not be necessary unless there is an immediate safety threat. While regulatory agencies may be required later, it is more critical to resolve the immediate issues to prevent further non-compliance. Training is essential but should follow after addressing specific operational problems. Question 4. Considering the information provided, Mr. Jenkins, a nuclear medicine technologist, is preparing a radiopharmaceutical for patient administration. What is the primary reason why it is critical to ensure that the dose calibrator is properly calibrated before use? A. To verify the proper chemical composition of the radiopharmaceutical. B. To ensure the accuracy of the administered radiation dose to the patient. C. To guarantee that the radiopharmaceutical is safe for injection. D. To avoid radioactive contamination in the preparation area. Answer. Correct answer B. To ensure the accuracy of the administered radiation dose to the patient. Explanation. The primary role of the dose calibrator is to measure the activity of the radiopharmaceutical accurately before it is administered. Calibration ensures that the correct dose is delivered to the patient, adhering to both medical and safety standards. Ensuring accuracy is essential to avoid underdosing or overdosing, both of which could result in inadequate therapy. Effects or increased patient risk, while ensuring chemical composition and safety are also important. The dose calibrator's main purpose is related to activity measurement. Question 5. Based on the information provided, which of the following materials would be the most effective shielding against high-energy gamma radiation from a cobalt-60 source in a medical facility? A. Concrete. B. Lead. C. Aluminum. D. Plastic. Answer. Correct answer. B. Lead. Explanation. Lead is the most effective material for shielding against high-energy gamma radiation, such as that emitted by cobalt-60. Gamma radiation has high penetration power, so dense materials like lead are required to significantly reduce its intensity. Concrete, while effective, requires greater thickness compared to lead. Aluminum and plastic are less effective against gamma rays because they do not provide density or thickness to attenuate high-energy gamma radiation. Question 6. In the context of radiation safety, Ms. Clark, a radiation safety officer, notices that personnel working near a high-activity radioactive source are not wearing their dosimeters. What should she do first? A. Immediately cease all work with the radioactive source. B. Ensure that dosimeters are distributed and personnel are informed of the requirement. C. Report the incident to regulatory authorities. D. Conduct an investigation into why dosimeters were not issued. Answer. Correct answer. B. Ensure that dosimeters are distributed and personnel are informed of the requirement. Explanation. The first step is to ensure that dosimeters are provided to all personnel working near high-activity radioactive sources. Dosimeters are essential for monitoring radiation exposure and ensuring that workers do not exceed permissible dose limits. The requirement for dosimeter usage should be reinforced immediately. Stopping work is permitted without first addressing the issue of dosimeter distribution. Reporting the incident and investigating the failure to provide dosimeters are secondary actions once the immediate need for proper monitoring has been addressed. Question 7. What factors contribute to the radiation risk associated with a specific radioactive material used in nuclear medicine? A. The half-life of the radionuclide in its chemical form. B. The method of production of the radiopharmaceutical. C. The dose rate at the point of administration. D. The patient's age and medical history. Answer. Correct answer. A. The half-life of the radionuclide in its chemical form. Explanation. The radiation risk associated with a radioactive material primarily depends on its half-life and chemical form. The half-life determines how long the material will remain radioactive and the duration of potential exposure. The chemical form affects how the material behaves in the body and how it is eliminated, influencing both radiation exposure and toxicity. While dose rate, patient factors, and production methods are relevant, the key contributors to radiation risk are the physical and chemical properties of the radionuclide. Question 8. Given the circumstances, Dr. Williams is responsible for conducting a radiation safety assessment in a newly constructed nuclear medicine facility. What is the most important consideration when designing the shielding for the facility? A. The financial cost of the shielding materials. B. The type of radioactive materials that will be used. C. The size of the rooms and layout of the facility. D. The aesthetic design of the shielding materials. Answer. Correct answer. B. The type of radioactive materials that will be used. Explanation. The type of radioactive materials used is the most important factor when designing radiation shielding. Different types of radiation, alpha, beta, gamma, have varying penetration abilities and the shielding must be tailored accordingly. For example, gamma radiation requires dense materials like lead, while beta radiation can be shielded with lighter materials such as plastic. The layout and size of the rooms are also important, but they are secondary to ensuring that the proper materials are used to attenuate radiation from specific sources. Question 9. The relationship between linear energy transfer and biological damage is crucial when assessing the risks of radiation. Which of the following statements best describes this relationship? A. High-let radiation is more likely to cause deterministic effects. B. Low-let radiation is more likely to cause deterministic effects. C. Let does not significantly affect the biological damage caused by radiation. D. High-let radiation causes only indirect biological effects. Answer. Correct answer: a high-let radiation is more likely to cause deterministic effects. Explanation: high-let radiation, such as alpha particles, delivers more energy over a short distance, resulting in a higher probability of causing deterministic effects, which are dose-dependent, e.g. radiation burns, tissue damage. Low-let radiation, such as gamma rays, is less likely to cause deterministic effects, but may contribute to stochastic, e.g. cancer. 11. A radiation type is a critical factor in assessing the severity of its biological impact. Question 10. Under the assumption that a radiopharmaceutical with a half-life of 6 hours is being prepared, what is the most important factor to consider when storing the material before administration? A. The ambient temperature of the storage area. B. The method of radiation detection used for measurement. C. The time between preparation and administration. D. The ventilation system in the storage area. Answer. Correct answer: C. The time between preparation and administration. Explanation: the half-life of a radiopharmaceutical determines how long it remains effective for therapeutic or diagnostic purposes. The shorter the half-life, the more critical the timing between preparation and administration comes. Delays can result in a significant reduction in the material's activity, affecting the dose received by the patient, while storage conditions like temp and ventilation may influence the integrity of the compound. The primary concern is the time elapsed between preparation and administration to ensure accurate dosing. Question 11. In the context of radiation safety, Mr. Green is conducting a routine check of his department's dose calibrator. He finds that the device shows discrepancy between the actual radioactive source activity and the calculated activity. What should Mr. Green do to ensure the accuracy of the dose calibrator's readings? A. Conduct quality control test using different radioactive source to compare results. B. Immediately discontinue use of the dose calibrator and notify the safety officer. C. Repeat the test several times to verify if the discrepancy persists and ensure proper calibration. D. Adjust the settings on the dose calibrator manually to match the expected activity. Answer. Correct answer: A. Explanation: regular calibration and quality control of dose calibrators are essential for ensuring accurate measurements. If a discrepancy is found, Mr. Green should conduct quality control tests with a different radioactive source, which helps confirm that the calibrator is performing as expected. Adjusting the settings or discontinuing use could cause delays in procedures, while repeating tests without verification could lead to conclusions. According to the NRC and industry standards, it is crucial to follow prescribed protocols for calibration and report significant discrepancies promptly. Question 12. Considering the evidence in radiation protection, how does the inverse square law apply in clinical settings where radiation sources are used, such as in SPECT or PET scans? A. Radiation intensity increases as you move away from the source. B. Radiation intensity remains constant regardless of the distance from the source. C. Radiation intensity decreases as you move away from the source, with the distance squared. D. The inverse square law does not apply to high-energy radiation sources. Answer. Correct answer: C. Explanation: the inverse square law states that radiation intensity decreases with the square of the distance from the source. This principle is critical for managing exposure in clinical settings like SPECT and PET scans, where careful positioning and maintaining appropriate distances from radiation sources can significantly reduce staff and patient exposure. The application of this law is supported by radiation protection guidelines, regulations, including those from the NRC and EAR, to minimize unnecessary exposure. Question 13. Mr. Carter, a radiation safety officer, is reviewing the safety protocols for handling radioactive materials in his department. According to national safety guidelines, what is the primary purpose of implementing the ALARA as low as reasonably achievable principle in radiation protection? A. To maximize the dose received by patients for effective treatment. B. To ensure that radiation exposure to personnel, patients, and the public is minimized. C. To comply with international regulations and minimize regulatory oversight. D. To increase the operational efficiency of radiation-based medical procedures. Answer. Correct answer: B. Explanation: the ALARA principle is designed to minimize radiation exposure to as low A level is reasonably achievable while still allowing the necessary clinical or diagnostic procedures to be performed. It is rooted in radiation safety regulations from organizations like the NRC and IA, which emphasize the importance of minimizing risks associated with ionizing radiation. Compliance with ALARA not enhances safety but also ensures that exposures to staff, patients, and the public are kept within regulated limits. Question 14. From a practical standpoint, Dr. Johnson is planning a radiotherapy treatment involving an unsealed radioactive source. Which of the following safety measures should he prioritize to protect staff and patients during the procedure? A. Restricting patient access to the treatment area for at least 48 hours post-treatment. B. Wearing lead aprons and using shielding as primary protection measures. C. Using a low-energy radioactive source to reduce exposure. D. Performing a thorough decontamination of all equipment after each use. Answer. Correct answer, B. Explanation. In radiotherapy with unsealed radioactive sources, shielding is one of the most effective means of protection against radiation exposure. The use of lead aprons and appropriate barriers combined with time and distance considerations helps reduce radiation exposure to personnel and patients. While decontamination and restricted access may be necessary for specific cases, shielding provides the primary protective measure recommended in both national regulations and the ALARA principle. Question 15. To illustrate this point, when conducting routine surveys for contamination in a nuclear medicine facility, which of the following actions should the radiation safety officer take to ensure compliance with radiation protection standards? A. Perform surveys immediately after patient procedures, including checking the floors, equipment, and surfaces. B. Focus exclusively on patient rooms and exclude storage areas where radioactive materials are handled. C. Conduct surveys only if visible contamination is suspected. D. Perform surveys once a week, regardless of the frequency of patient procedures. Answer. Correct answer, A. Explanation. Radiation safety officers must conduct thorough surveys for contamination, especially immediately after patient procedures. This helps detect any residual radioactive material and prevent exposure to staff or the public. Surfaces, equipment, and floors should be checked regularly as contamination can occur anywhere in the facility, including areas like storage rooms. Compliance with guidelines from the NRC ALARA ensures that any contamination is promptly identified and addressed. Question 16. Considering the evidence from radiation protection models, which of the following factors significantly affects a person's sensitivity to ionizing radiation? A. The type of radiation source being used. B. The age and gender of the individual. C. The method of radiation detection employed. D. The energy level of the radiation source. Answer. Correct answer, B. Explanation. Age and gender significantly influence an individual's sensitivity to ionizing radiation. For example, children and young adults are more sensitive to radiation than adults due to their faster cell division rates. This is crucial when assessing radiation risks in medical procedures. The NRC and EA regulations emphasize special considerations for pediatric patients as they are at high risk for long effects such as cancer. Similarly, gender-specific risk assessments may be relevant due to differences in biological responses. Question 17. When analyzing the risk of radiation exposure during a nuclear medicine procedure, Taylor is tasked with estimating the patient's radiation dose. Which of the following factors should he consider in his calculation? A. The energy of the radiation and the patient's body mass in XBMI. B. The duration of exposure and the amount of radiation emitted by the source. C. The age and gender of the patient only. D. The distance between the patient and the radiation source. Answer. Correct answer, B. Explanation. To estimate the radiation dose, factors such as the duration of exposure, the amount of radiation emitted by the source, and the energy of the radiation are key. These factors determine how much radiation the patient will absorb during the procedure. The NRC and IA guidelines on radiation dose estimation emphasize these variables to ensure accurate risk assessments. While BMI, age, and gender may influence radiation sensitivity, they are secondary to the basic physical properties of the exposure. Question 18. Under the assumption that a radioactive spill occurs in the nuclear medicine laboratory, which of the following actions should be taken first according to emergency procedures? A. Evacuate all personnel from the room immediately. B. Notify the radiation safety officer and wait for further instructions. C. Seal off the affected area and prevent anyone from entering. D. Begin decontamination procedures immediately, starting with the contaminated personnel. Answer. Correct answer. See explanation. The first step in responding to a radioactive spill is to secure the area and prevent anyone from entering, thereby containing the spread of contamination. Once the area is sealed off, the radiation safety officer should be notified to guide further actions, including decontamination and medical evaluation if necessary. This protocol is aligned with emergency response guidelines provided by the NRCNI to minimize exposure and contamination. Question 19. What would happen if radiation shielding is not properly used during the preparation and administration of radiopharmaceuticals in a nuclear medicine facility? A. The radiation exposure to the medical staff would be significantly reduced. B. The effectiveness of the radiopharmaceuticals would be compromised. C. The radiation exposure to staff and patients could increase, violating ALARA principles. D. The radiopharmaceuticals would become radioactive themselves, creating a hazardous environment. Answer. Correct answer. C. Explanation. Improper use of radiation shielding could significantly increase radiation exposure to medical staff and patients, violating the ALARA principles. Shielding is a critical element of radiation protection to minimize exposure, especially when handling radiopharmaceuticals. The NRCNIA guidelines require the use of appropriate shielding materials, such as lead, and careful planning during the preparation administration process to ensure safety. Question 20. Mr. Hall is reviewing the proper usage of survey meters in his facility. He notices that the survey meter's reading is inconsistent when measuring background radiation levels. What is the most likely cause of this discrepancy? A. The survey meter is not calibrated correctly. B. Background radiation levels fluctuate naturally and cannot be measured accurately. C. The meter is malfunctioning due to low battery power. D. The meter has been incorrectly used and needs recalibration. Answer. Correct answer. A. Explanation. An incorrect calibration of the survey meter is the most likely cause of inconsistent readings. Survey meters must be regularly calibrated according to the manufacturer's instructions and regulatory standards to ensure their accuracy. Inconsistent readings could lead to false conclusions regarding radiation levels in the environment, endangering both staff and patients. Calibration protocols from the NRC always be followed to ensure correct measurements. Question 21. Dr. Lewis is working in a nuclear medicine department and is preparing to administer a radiopharmaceutical to minimize the radiation exposure to herself and other personnel. Which of the following is the most important factor to consider? A. Using the shortest possible exposure time during the administration. B. Increasing the distance between the radiation source and the staff. C. Wearing a lead apron during all patient procedures. D. Ensuring that the patient has an appropriate radiation dose based on their weight. Answer. Correct answer. B. Explanation. Increasing the distance between the radiation source and staff is the most effective way to minimize radiation exposure as per the inverse square law. While time and shielding are important, distance provides a greater reduction in exposure. The ALARA principle advocates for reducing exposure through distance when possible. Question 22. A radiation safety officer at a hospital finds that the dose rate at a controlled area exceeds the regulatory limits. What is the first action the officer should take according to radiation safety protocols? A. Immediately evacuate all personnel from the area. B. Notify the facility's medical director and regulatory bodies. C. Temporarily restrict access to the area and investigate the source of the problem. D. Disable the radiation equipment until full investigation can be conducted. Answer. Correct answer. C. Explanation. When a dose rate exceeds regulatory limits, the first action is to restrict access to the area and investigate the source of the increased radiation. This helps prevent further exposure while allowing time to address the issue. Immediate evacuation might be necessary later, but the first step is typically controlling access and identifying the cause. Question 23. Octakata is using a gamma camera to conduct a scan. After reviewing the radiation protection protocols, she notices a discrepancy in the shield thickness of the camera's housing. What is the most appropriate course of action? A. Immediately report the issue to the radiation safety officer and halt the procedure. B. Ignore the discrepancy as the camera is still operational and the radiation is minimal. C. Adjust the shielding manually before proceeding with the scan. D. Continue the procedure but use additional protective equipment for personnel. Answer. Correct answer. A. Explanation. Any discrepancy in the shielding of radiation equipment should be reported to the radiation safety officer immediately. Shielding is crucial for radiation protection, and discrepancies can lead to increased exposure to staff and patients. It is important to halt procedures until the issue is resolved in accordance with safety protocols. Question 24. In the event of a radiation overexposure incident, which of the following actions is the most important for the affected individual to take immediately? A. Take an anti-radiation medication to reduce the effects of exposure. B. Remove themselves from the contaminated area as quickly as possible. C. Perform a full decontamination of their body and clothes. D. Begin filling out a radiation exposure report for documentation. Answer. Correct answer. B. Explanation. The immediate action for an individual involved in a radiation overexposure incident is to remove themselves from the contaminated area as quickly as possible to limit further exposure, while decontamination and reporting are essential steps. Minimizing the exposure time is the first priority in managing radiation overexposure. Question 25. During a routine radiation survey in a medical facility, a radiation safety officer detects contamination on the floor. What is the next step the officer should take to resolve this situation? A. Apply a decontamination solution to the area and wipe it down immediately. B. Mark off the contaminated area and initiate a formal decontamination protocol. C. Wait for the contamination to naturally decay before addressing it. D. Notify the hospital administrator and postpone all procedures until the area is clean. Answer. Correct answer. B. Explanation. The proper response to detecting contamination is to immediately mark off the contaminated area and begin the decontamination process following established protocols. This ensures the safety of staff and patients and complies with radiation safety standards. Waiting for decay or postponing procedures is not an acceptable response. Question 26. In the context of radiation protection, what is the primary reason for using a dosimeter in a medical facility that handles radioactive materials? A. To monitor radiation levels in the treatment rooms. B. To measure the radiation dose received by personnel. C. To check the effectiveness of shielding in the facility. D. To ensure that patients are not exposed to excessive radiation during diagnostic procedures. Answer. Correct answer. B. Explanation. The primary purpose of using a dosimeter is to measure the radiation dose received by personnel. It helps ensure that individual exposure remains within safe limits in line with regulatory standards such as those from the NRC and IA. Dosimeters provide real-time data that allows for monitoring and adjustments in radiation safety practices. Question 27. Dr. Martinez is reviewing the safety protocols for handling radioactive waste in her department. According to radiation protection guidelines, what is the most effective way to minimize the risk of contamination during waste disposal? A. Place all waste in a sealed, non-leaking container immediately after use. B. Dispose of the radioactive waste at the nearest available facility. C. Allow the waste to remain in the treatment area until it decays naturally. D. Use an automated system to collect and store the waste for later analysis. Answer. Correct answer. A. Explanation. The most effective way to minimize the risk of contamination during radioactive waste disposal is to immediately place the waste in sealed, non-leaking containers. This prevents spread and exposure to personnel and the environment. Proper labeling and disposal are also essential to ensure compliance with radiation protection standards. Question 28. During a radiation safety audit, it is discovered that certain safety protocols are not being followed by staff. What is the most appropriate action to take? A. Issue a written warning to all staff and stop all procedures. B. Conduct A training session to review and reinforce proper safety protocols. C. Discontinue the procedures indefinitely until further audits are conducted. D. Immediately suspend all staff who violated the safety protocols. Answer. Correct answer. B. Explanation. When safety protocols are not being followed, the most appropriate action is to conduct a training session to review and reinforce proper protocols. This helps improve staff understanding and adherence to safety guidelines, reducing the likelihood of future violations. Harsh measures like suspending staff should only be taken if safety is intentionally disregarded or if there are repeat violations. Question 29. A nuclear medicine facility is using a radiopharmaceutical with a half-life of 6 hours. What is the recommended practice for managing the remaining radioactive material after use? A. Store the remaining material in a secure container until it decays completely. B. Dispose of the remaining material in the hospital's regular waste disposal system. C. Shield the remaining material with lead and leave it in a secure location for several days. D. Dispose of the remaining material according to specific guidelines for radioactive waste disposal. Answer. Correct answer. D. Explanation. The remaining radioactive material should be disposed of according to specific radioactive waste disposal guidelines. These guidelines ensure safe handling, storage, and disposal in compliance with NRC and IA regulations. Simply storing or improperly disposing of radioactive waste can lead to contamination risks. Question 30. When assessing radiation exposure risks during a procedure, which of the following factors should be considered to ensure minimal risk to personnel? A. The amount of shielding used during the procedure. B. The type of radiation and energy level emitted by the source. C. The distance from the radiation source and exposure time. D. All of the above. Answer. Correct answer. D. Explanation. All the factors listed. Shielding, type of radiation, energy level, distance, and exposure time should be considered to minimize radiation exposure to personnel. Effective radiation protection requires a comprehensive approach that incorporates multiple safety measures to ensure that the exposure remains as low as reasonably achievable. Alara.